Good afternoon. My name's Garth Reynolds. I'm the Executive Director for the Illinois Pharmacists Association. And today, alongside the Illinois Council of Health System Pharmacists, we're standing together to address the growing crisis in Illinois pharmacy benefit managers and how they're driving up costs, restricting patient choice, and threatening the survival of all community pharmacies. PBMs were meant to lower costs, but they've become the middlemen, profiting from opaque and often predatory tactics. And patients are paying the direct price. This isn't just about business. It's about ensuring that Illinois families can afford their medications and maintain access to their trusted local pharmacists. I'm going to turn the podium over now to Chris Crank from ICHP.
Thank you. PBM reform is an important aspect to patient care and patient access in Illinois. Pharmacies are so critical to patient care, whether that be in the community, in the hospital, and many various settings in Illinois. And their practices are really limiting the ability for patients to get care. And I think that's the key. You're going to hear some stories from individuals. I want everybody to realize that this is it's a practice that, yes, it's a business practice, but what it results in is decreased access to patient care, or for patients for care in Illinois.
Yep. Thank you, and it's a pleasure to be here, and I'm very proud to have been asked to be the Senate sponsor of the governor's PBM reform bill. Representative Natalie Manley is going to be the House sponsor, so this is an issue we have to tackle. There's a reason that there is high costs of health care, and particularly in pharmacy, and that's because middle people take a big hunk of profit out of the middle of that, and it's not the local pharmacies. Just like, I believe firmly that healthcare ought to be between the patient and the doctor, I believe that pharmacies fit in there as well. So we're going to do everything we can to try to right this ship and make sure that we don't lose our independent pharmacies. My own pharmacist in Peoria is a lifeline to the community. They really treat their patients like their family. I know that because I'm one of those patients. But this is a critical issue for whether you're in an urban area, and there are pharmacy deserts, that exist in urban environments. There as well in rural environments, and so this goes across the state of Illinois. So we have to do everything in our power we can to be able to make sure that independent pharmacies are there in place to serve our needs. And so again, I'm happy to be here and happy to be a sponsor of the bill.
Good afternoon. My name's David Baggett. I'm the president of the Illinois Pharmacists Association and the owner of a community pharmacy in Petersburg, Illinois. I'm here today to discuss the critical issue facing our healthcare infrastructure, one that is rapidly deteriorating due to the harmful practices of PBMs and their health insurance conglomerates. I have a deep understanding of this topic as I live it every day in my community pharmacy. Across the country, we saw over 2,000 pharmacies close last year. More than 80 of those closures were here in Illinois. These closures affect both independently owned pharmacies and chain stores. Recently, Walgreens announced the closure of 1,200 stores nationwide. Meanwhile, PBMs continue to rake in obscene profits. So, what exactly are PBMs doing to our healthcare system? PBMs are the quintessential middlemen in our healthcare system, but they are not serving the patients or the pharmacies. Instead, they are focused solely on increasing their profits, and here's how. Network creation. PBMs create pharmacy networks, directing patients with prescription drug benefits to specific pharmacies, deciding which pharmacies will get paid and how much. Formulary control. A formulary is a list of medications covered by an insurance plan. PBMs create these formularies through negotiations with pharmaceutical manufacturers. The drugs included on those, the drugs that they include are often the ones that the manufacturers will offer the highest rebate or financial incentive in exchange for favorable placement on that formulary. I use the word rebate, however, given the money never reaches the patient, and that's where rebates go to the user, these are more like kickbacks. So, kickbacks and price inflation. These negotiations are nothing more than legalized extortion. PBMs ask multiple drug manufacturers who will pay us the most to list your drug on our formulary. The highest bidder gets preferential treatment, and the patient pays the price. These artificially inflated prices are passed on to patients in the form of higher copays and higher premiums. PBMs have a monopoly. Multiple PBMs own or are owned by health insurance companies. And they also own pharmacies that directly compete with independent, non-affiliated pharmacies. Essentially, this means independent pharmacies are being selectively and knowingly paid below their acquisition cost for the drug by their competition. Steering and patient disparities. PBMs steer patients to their own affiliated pharmacies, paying them far more than they pay independent pharmacies. This undercuts the independents, forcing many to close their doors, and this in turn leads to pharmacy deserts. Profit over patient care. PBMs are the most profitable entities in the prescription drug supply chain, period. They rank number 4, number 6, and number 16 on the Fortune 500 list, far ahead of the nearest drug manufacturer, which is Pfizer, who comes in at number 40. This obscene profitability is the result of business practices that have raised healthcare premiums, forced closures of local pharmacies, and driven up patient costs, all while putting the health and wellness of patients at risk. The business model of PBMs is unsustainable. Their relentless pursuit of profit has led to an erosion of the healthcare system, harming patients, pharmacists, and healthcare providers alike. They cut reimbursement rates for pharmacies. As they cut reimbursement rate for pharmacies, patients lose access to the care they deserve. Community pharmacies are forced to reduce services and staff, and patients are increasingly steered towards PBM, self-owned mail-order pharmacies, where they have no access to the essential counsel of a pharmacist, the most accessible healthcare professional. 66 cents of every dollar spent at a local pharmacy gets put back into the local economy and help provide necessary healthcare frontline touchpoints for patient access. PBMs take their profits, hundreds of millions of dollars worth, and send them out of state. This is why we're here today, urging for regulatory reform. The pharmacy infrastructure in Illinois and across the country is on the brink of collapse. We must act before pharmacies close and more patients are left without proper care. I would like to take this moment to express my sincere gratitude to Leader Kaler and to Representative Manley for their unwavering commitment to addressing this crisis. Their leadership in introducing legislation aimed at reining in the abusive practices of PBMs is a beacon of hope for our state's healthcare system. I also want to thank Governor Pritzker for prioritizing this issue in his recent State of the State address. It is through the tireless efforts of these elected officials that we hope to see the end of PBM-driven practices that have long terrorized patients and pharmacies here in Illinois. Together, we can ensure that PBMs no longer control the system at the expense of the patients in the pharmacies. We are committed to restoring fairness and transparency to our healthcare system. However, we must not overlook the broader issue. Multiple bills have been filed in the General Assembly to tackle prescription drug prices. While we applaud the intent behind those efforts, I issue a warning. PBMs have too much control over the prescription drug market. Any attempt at lowering drug prices without regulating PBMs will ultimately fail. Not only will they fail, but in the long run, they will harm patients and the pharmacies that provide needed medications and patient care for them. I urge everyone interested in bringing down drug prices and making medications accessible to all patients to join us in a comprehensive rewrite of how medication is paid for, both in our state and in our country. So now, let me tell you who we're talking about. At number 4 on the Fortune 500 list is Optum Rx. They're owned by United Health. They also have mail order and specialty pharmacies. They are currently under investigation by the FTC for anti-competitive business practices. Coming in at number 6 on the Fortune 500 list is CVS Health. With its PBM Caremark and its health insurance arm Aetna, CVS obviously also owns retail pharmacies. They too are under investigation by the FTC for anti-competitive practices. At number 16 on the Fortune 500 list is Express Scripts, owned by Cigna. They also own Accredo, a specialty and mail order pharmacy. And guess what? They too are under investigation by the FTC for anti-competitive business practices. These companies are driving up costs, reducing access to care, and putting profits over patients. The time to act is now. Thank you. Next is Bill Schmidt.
Well, good afternoon. I'm Bill Schmitnick. I'm here today not because that I want to be here, we'll say. I'm here because of my son Cole, and he lost his life. This was due to the unchecked power and harmful practices of the top pharmacy benefit managers in America. Cole was 22 when he passed away in January of 2024. He was full of life, had dreams for the future, and should still be here today. But the top PBM stood between Cole and the medication he desperately needed. Just like millions of Americans, Cole relied on his prescribed asthma medicines, yet due to the complex and opaque system controlled by the PBMs, he was denied timely access to his needed medication. These top middlemen, who were never doctors, dictated whether he could afford to obtain a drug that could save his life, or these top, these top pharmacy benefit managers also manipulate the drug pricing. They impose the unnecessary decisions around the medications covered, and they decide, what my son had to choose from. This is not the only story in America like this. There's many, many others out there. I'm from Wisconsin. I have my heart right over here with everybody, though. I'm telling you right now. My wife and I are committed to helping with this PBM reform mission. We are going to get it done, and great organizations, great support from elected officials, and we're taking it across the nation. And I'm glad to be with Illinois on this day today because we got the right recipe, I think. So all I can say is the PBM reform needs to happen. Thank you.
We'll open for any questions if there are any from.
Is Garth and anyone else wants to take it? I talked to some of the PBM trade groups last week, and they say the governor misses the mark. He doesn't really understand what PBMs do, and that really is drug manufacturers who are the ones who set the prices, and they need to be part of any conversation. And I just was curious if you or anyone else wants to kind of respond to that idea.
One, I'm glad to see all partners come to the table, and as we know, pharma does allow through their manufacturers, allow access to much needed medications. But what the PBMs failed to say there is their manipulative practices that drive up those prices. We talked about rebates, and that's basically forcing manufacturers into a pay-to-play system. And by doing that system where they get market advantage, drives up healthcare costs. And that ultimately ends up being paid by our patients and driving up employer costs. So if we look at initiatives, what's being proposed and has been proposed into the General Assembly of bringing more of those rebate dollars back to the employer plan sponsors and back to patients ultimately, we will save money and get a lot of the foolishness that continues to be done through the PBMs in driving healthcare costs. If they were truly the middleman that they are supposed to be in driving down these healthcare costs, how come healthcare costs in the country continues to skyrocket the more that they're unchecked? The last 20 years, medications continue to go up every year. You look how much the health dollar is now from what it was in 2000, and the PBMs have failed on their mission. They shouldn't be asking and trying to be applauded for their effort. They should be shamed for what they do.
The other thing I would ask, this question comes up a lot, is that at the FTC or in the federal level in the House hearing discussing the question of do PBMs set drug prices? The answer is no. But the question for PBMs that I would ask if I got the chance is, do you influence drug prices? And their ability to say, no, we have no influence or impact on drug prices would be one that would catch them. But they do. Those rebates do impact the price of drugs for citizens of Illinois.
Some people may also be wondering why this isn't being pushed forward on, quicker on the federal level. Why is it important for Illinois to address it now before federal action?
I was going to answer the question you had, but I'll answer yours first. We need the federal government to act beyond a shadow of a doubt. I would tentatively say the federal government is a bit more dysfunctional than our state government, and they have a tough time pushing things through. We have several bills that would address Medicare, Medicaid in the federal government that were on the continuing resolution. That was the second time they had been added to a spending package, and at the last minute pulled off each time. Now we're being told that these bills could pass before the first quarter is over. Guess what they're putting them on again? A spending resolution. So I believe that's where the difficulty lies, but you would actually have to ask the people that are elected to serve in Washington, D.C. And I'd like to also mention on the who's making drug prices so high. PBMs have safe harbor from anti-kickback laws. Do you follow? I mean, the rest of us cannot have a pay-to-play system and get away with it. We would be breaking the law. So the drug companies, beyond a shadow of a doubt, set the price. They set the price based on what their research costs them to do and what their expenses are right now, so that they have a profit, right? There's nothing wrong with that. Their biggest expense is the damn kickback. That is why it's PBMs, not drug companies.
And I'll just quickly add about the federal component. It's vital that we get additional groundwork, foundational regulations on the federal level, because the states have been working hard on this, and some states, including Illinois, have been working on this in some form even back to the 90s on trying to curb these behaviors. But the states continue to have to pivot, because then we'll call it another fee or another structure or another program until we finally get foundational federal legislation to help that. The states are great, can have a great impact on this because they impact a lot of infrastructure on the regulation side, but the feds continue to not help us with not having some type of foundation. Hopefully that will change. There's a committee today in the U.S. House Oversight hearing on PBMs today. So this is national attention, just as much focus as it is here in Illinois. And I'll turn it over to Leader Malin.
My apologies for running late. It's an unpopular thing in the House these days. I didn't hear the bell. The time has come for Illinois to take decisive action to regulate pharmacy benefit managers, the PBMs. For far too long, PBMs have taken advantage of their powerful position within the drug supply chain, prioritizing profits over well-being of our patients, plan sponsors, and community pharmacies. Their practices have not only driven up medication costs, but also eroded the quality of care. Each year, plan sponsors face premium hikes that far outpace inflation, while patients encounter unnecessary barriers to accessing their prescribed medications. Whether it's rejected claims, restrictive fail first, or step therapy requirements, or the burden of high deductible plans that make life-saving drugs unaffordable at the start of every year, Illinois families are struggling. Meanwhile, our local pharmacies, especially independent ones, are being forced to operate under unsustainable conditions. They face drastically low reimbursement rates while losing patients to PBM-owned pharmacies. Even more troubling is the use of retroactive recoupments, which undercut already paper-thin margins and push many pharmacies to the brink of closure. The impact is staggering. In 2010, Illinois was home to 708 independent pharmacies. By 2023, that number had plummeted to just 395, a 44% decline in just over a decade. We cannot allow this trend to continue. This is why I am joining forces with Senator Kaler to introduce comprehensive legislation that will finally hold PBMs accountable. Our bill aims to curb the harmful business practices of PBMs, reduce premiums, and protect our community pharmacies. We are taking a stand because we see firsthand the damage PBMs are causing in our neighborhoods. We are not alone in this fight. Governor Pritzker underscored the urgency of this issue in his recent budget address, making it clear that addressing PBM practices is a priority for his administration. With bipartisan support, we are determined to move this legislation forward and protect our patients, plan sponsors, and pharmacies from unfair practices. Illinois deserves better. Our communities deserve better. And we will not rest until we get this done. Thank you.
Mayor Manley, you've been chairing committees for the better part of a year now, looking at this issue. I wonder if you could just talk a little bit about some of the things you've learned during that and how that's helping to craft this legislation this session.
Things I've learned, oh my gosh. First of all, this is an extremely complicated issue. Every time I sit down with anyone, whether it's on the PBM side, on the pharma side, I learned so much, and it's a lot. And so I joke about having to put up a mob boss chart, but there are so many moving parts, and everybody has their side of the story. And so it's taken a lot, and if you're aware, I've been having subject matter hearings all summer, and every time we sit down, we learn something new. I learned about vertical integration. I call it the evil empire, but it's when 3 companies have the market on 80% of the market, which includes the manufacturer, the wholesaler, the PBM, the insurance company, and the brick and mortar pharmacy, all are owned by the same people. There are three towers that are owned, and they take up 80% of the market. That's a problem. The only part in that tower that is not regulated is the PBMs. So I think the transparency component of this is going to be huge, and I will learn a lot more once we get that in front of us.
Great. And then for you or the senator, just kind of what's the timeline right now? When can we expect some action in committee, or even more on this proposal?
We're finalizing the language right now of the bill, and that'll be filed hopefully next week, if not shortly after, and then we'll proceed with that. But we're intending, as the governor indicated, this is a high priority, that we will pass this year.
I know it was mentioned, PBM reform has been something that's been attempted for since the 90s, and I know it's been a focal point for this legislator for a decent amount of time. What makes this year different? What is it going to take to get this over the finish line?
Well, prices keep going up and up, and we hear from our constituents that they just can't afford health care anymore. They can't afford their medications. You have to ask the question, why is it, and there's legislation I think this year that's been filed, why is it that people think that going to Canada is going to give them a cheaper prescription when those drugs are mostly made in the United States? So what is the difference in that? Well, the difference is what is being spelled out here. It's middlemen taking that big hunk of profit right out of the middle of this thing. And that's the difference. It's very easy to understand. That's why we've got to have some reform. And the governor, in elevating this to one of his top priorities in his budget address, state address, that is going to make the difference. I mean, I think we're finally getting people's attention. We're finally educating the public as to what PBMs are. Hopefully it's going to be something that we can go throughout the state is to say, you need to pay attention to this. Talk about why drug prices are high. This is why they're high. And by our efforts, we're going to see that come down.
I'd also like to say that we've become like a nation of quick words, like, I don't know, fake news, everybody gloms onto that. Well, everybody thought it was big pharma, right? And everybody pointed the finger at them. Turns out it's not them. So we're going to kind of pull the curtain back on that and really make a difference. And the governor has been a partner in this, and I am so grateful that they're making it a huge priority. This is a bipartisan issue, and I really think we're going to at least start down the track to make things better for us.
Any of the stakeholders, what does it mean for the governor to make this such a priority this spring?
It's huge. It means that all the years and hours of advocacy and people coming as they have today for Illinois Pharmacy Legislative Day, talking on behalf of our patients, that we've been heard. And we're so grateful to the governor for elevating it to this important issue. And it's come at a right time where the consensus both on a national and multiple states have finally said they've had enough. And it's time for change.
Thank you, everyone.
Thank you.
Thank you.